Welcome everyone. My name is Dr. Anya Weissman and my channel is all about aesthetics, marketing, primarily education, and skincare. Today's video is about what I personally have had done because I get questions all the time asking me what procedures I've had done. If you're interested in this type of content, please subscribe, like this video, share with your friends, and you can hit the notification bell if you want to be notified when I publish. I'm going to start off with the very first procedure I ever had, which was a tear trough filler. This was years ago and I knew nothing about aesthetics. And now that I look back on that experience, I'm lucky that I went to a well-known and good injector because I was never told of any risks. I had no idea there was any risk associated with filler in the tear troughs. I wasn't informed of anything. It was just, here, can you just sign here before we get started? So note to self and tip to all of you, you always want to go to someone who will discuss the risks and the benefits of every procedure and make sure the consent is actually informed versus just a quick signature. So that's terrifying when I think back in retrospect. And then I didn't have anything done for years and years and years. And of course, eventually I tried neurotoxin and I've tried Botox and Dysport, and most recently I've tried Daxxify, and I'm really impressed with Daxxify so far, but it is quite expensive. And otherwise my favorite go-to is Dysport, because it's more concentrated per volume than Botox. So you get more bang for your buck in a sense, which translates into the toxin kicking in a little sooner and lasting just a little bit longer than Botox, in my opinion. The fact that there's more per volume, that has been studied and published, but the fact that I like it, but it's personal preference. After that, I have had fillers done in my cheeks. Again, I didn't really know what was going to happen and I hated how it looked, so I had it dissolved. I have had radiesse once, which that would be my one regret, because you can't dissolve radiesse. That's hydroxyl, it's a biostimulator called calcium hydroxyl apatite, and it's wonderful for masculinization of the face. If you want real structure, sharp jawline, sharp cheekbones, radiesse has that ability to really give you sharp contour, but you can't dissolve it. And the thing about our faces is they change over time. Our bone resorbs, gravity pulls. So over time, filler once looked perfect, and over time, it migrates, things move, things change, and it may not look as good and we may want to dissolve it. But if you do something that's permanent, and there are other permanent fillers like Bellafill, which I would never do, you can't dissolve them. So I personally am not a fan of non-dissolvable fillers. I do think hyperdilute radiesse for the body is great, but just radiesse in the face is not for me. I don't do it, I don't like it, but I know it can give beautiful results. In my opinion, my favorite is, again, masculinizing the face, very strong, sharp features. That's what I like radiesse for. But I know it's popular, a lot of people love it, just personal preference. I've had a thread lift before. I've had it twice actually, and one time I loved it and another time I hated it. And again, it depends on the person doing the procedure and really just, I guess, how focused they are that day. I don't know, but it's beautiful, or it can be beautiful for lifting the face. If you don't want a facelift, or if you're wanting to segue into a facelift slowly, threads can be beautiful. The only problem with threads is that they are unpredictable. And so some people have a beautiful outcome that can last a year to 2 years. And other people will have an outcome that will last 4 to 6 months. And so you can't predict until you try to know how effective it will be. If you are shopping around for threads, the one comment I will make is that there are generally speaking, there are two types of threads. There are threads that are called cut threads and molded threads. Cut threads are not as strong and they don't have as good a hold. So if you're shopping around, make sure you ask if the threads are cut or molded, and the molded ones are much, much better. They hold much better and they're stronger. So those would be the only kind of threads I would ever do or recommend. So that's it for, I would say, facial procedures per se. So now let's move on to lasers and energy-based devices and microneedling. So microneedling, as you may know, I'm a big fan of. I love microneedling. I think it's very underrated. And I think the reason why it's underrated is because it doesn't generate as much revenue for a practice as a laser can. And so if you're looking to make money, the laser will generate you more revenue. But I think it's absolutely wonderful for improvement in acne scars. And I also think it's wonderful for the other name it's known by, collagen induction therapy. The only thing I will say here is I'm not a fan of the derma rollers at home. I think they're dangerous. They shear and tear the skin. Absolutely not what you're looking for when you want to induce collagen. Those derma rollers really only damage your skin. But if you've got the needles that go straight up and down, so the only tear, well, there's no tear, but the only puncture is a vertical straight line, those are much better devices. And again, in the microneedling universe, there's different kinds of pens. So the best ones are not spring operated, because when you use a spring to cause the needle to be in motion, a spring can never be as regulated, and so you can't predict a precise depth every single time. Springs are a little unpredictable, so you need a better mechanism for completely regulated needle motion. And so the best microneedling device, in my opinion, is the Evo pen and the Skin pen. Those both have that type of technology. So I am a fan of that. I'm also a huge fan of Clear and Brilliant laser. I've had that done many, many times in the past. I just purchased one for my office. So I will only promote things that I love and that I have done myself or would do to myself again. This is a very, very gentle laser with minimal to no downtime that gives you a beautiful glow. In some patients, it's incredible at removing pigment. Again, no one laser fits everyone, but in general, it has 2 hand pieces. So it's basically 2 lasers, and one targets the texture, pores, even skin tone, and the other one targets pigmentation. And so together they can generate really beautiful results. This laser is also known as a baby fraxel because you need about 3 to 4 sessions of Clear and Brilliant to equate to 1 fraxel treatment. But of course, fraxel, I'm thinking specifically of the fraxel dual, that laser has downtime, about a week of downtime. So with Clear and Brilliant, it's a lot more versatile because the worst downtime you have is a little bit of a sunburn appearance, which tends to go away rather quickly within a day or 2. And then later on, you develop a sensation of sandpaper on your skin, which can interfere with makeup, and the appearance of makeup, but otherwise it's not noticeably visible. You don't have red marks or significant kind of dry peeling skin show up. So it's very, very gentle. So I love that one. I do also love Fraxel Dual, and I've also had that procedure done. It's phenomenal if you're willing to have that downtime. And I honestly think the results are very comparable. Let's say 4 Clear and Brilliants, 1 Fraxel, you're about at the same point in terms of results. I've also tried Thermage for skin tightening, and I've tried Morpheus 8 and Silfirm X. I am a fan of Silfirm X, and I feel that it does work. My concern with Morpheus is oftentimes I feel that the settings are set too strong and the operator of the machine is overzealous to do the treatment, and people can lose subcutaneous fat. And also if the needles are set too deep. So there's a risk with that, with radiofrequency microneedling. So it's really, really important to go to a good provider who understands that the settings should actually be quite gentle, and to do everything to minimize subcutaneous fat dissolving, unless of course you want to dissolve subcutaneous fat, which may be the case in the submentum. Sometimes it can be the case in this region. Some people want to dissolve that fat. That's a different story. It works well for that. Thermage, I felt just there was negligible result. It was so negligible that I'm not sure it would be worth paying even $100 or $200 for the service, but the service is far more expensive than that. So that I would never do again. It just wasn't worth it at all for me. And of course, we can't forget, most recently I had Sculptra. Now, I've been a huge fan of Sculptra for so long, and I do offer it in my practice, but I just never had it done on myself. And I always get the question, do you do it on yourself? And I felt silly saying no. Meanwhile, I'm proposing it to others. And so I thought I was way overdue to get it. And so I did just get it this week, and we'll see what the results will be, but I'm sure I'll love it because I love Sculptra. I love the results it gives. It's so natural, so beautiful. I'm a huge fan of Sculptra and have been for years. And I think that's all I've done. Just trying to think what else is there. For peels, I've done the 3-step peel from Zio, which is brilliant. That is just so beautiful in clarifying your texture and your tone, but it does require preparation before you can do the peel. And it requires, depending on your skin tone, it requires a higher dose of retinol or tretinoin prep before you can do the peel safely. It's not a deep depth peel, but it is quite strong, and so it requires a prep. So if you're willing to do the prep, it's absolutely worth it. It does have downtime of about 5 days. You peel quite a lot, but the results are beautiful. So that I love, and I actually want to do one. I want to do that, and I want to do Clear and Brilliant before Christmas. So we'll see if I get a chance to do it. So those are all the procedures that I can think of. I'm pretty sure there's nothing else that I've had done. Let me know what your thoughts are to the things I've said. Do you love some of the things I said I didn't like? Do you like some of the things I said I love? And what are you planning on trying next? I'd love to know. So until next time, I'll see you in the comments.